Hi, my name is Alice, and the healthcare debate is very personal to me, especially the animus towards Obamacare, the Affordable Care Act. I am somebody who is covered through my union. I have family health insurance, but my older daughter had already graduated from college and was no longer covered under my insurance. And if you recall, the first wave of the Affordable Care Act, the first phase-in, was when they allowed adult children under the age of 26 to go back on their parents' insurance plan. So my daughter was home. I hadn't seen her in a little while. I have a large house, so she was up in her room in the attic, and it suddenly occurred to me I hadn't seen her for 24 hours. And it turns out that she had a violent stomach bug. She was vomiting and had diarrhea, and by the time I had heard about it, it was a full 24 hours that she had been vomiting and sick. And so I went up to see her, and she kept saying, "I don't want to go to the doctor. We can't afford to go to the doctor. It'll be too expensive." And she had been drinking the Gatorade for the electrolytes. Everything she put into her mouth, she vomited. Or eliminated. And I was sufficiently alarmed to say, I appreciate your concern about the doctor bill, but let's call our doctor and see what she has to say. And she said, "How long has she been vomiting?" "Over 24 hours now." "Do you have a car?" "Yes, I do." "Get to the emergency room immediately. She may be on the verge of a heart attack. She's probably so dehydrated." And so there were no questions asked. And then in the course of the conversation with my doctor, we were of course reminded that, wait a minute, she is in fact covered because of my insurance, and she's 24 years old, and it was all brand spanking new. And we raced her to the emergency room, and sure enough, she was triaged immediately into the emergency room, where she was put on a saline drip, which her body sucked up like a sponge. I have never seen anything like it in my life. The bag literally went, her body absorbed this liquid. And so to me, I have so much empathy and compassion for the people for whom they're sitting there with themselves, or especially with their children, trying to decide whether or not they can afford to go to the doctor. And something as simple as a tummy bug, you wouldn't imagine being a life and death situation, but even a tummy bug can become a life and death situation. And why should anybody have to worry about this? Why should this even be debatable? This should be a human right. We have enough wealth in this country to make options available for everyone to be covered. It's unfathomable to me that this is even a conversation.